A few notes on neck side bending or cervical lateral flexion. It's one of the repeated movement tests I use for patients that have neck disorders. That doesn't mean they're necessarily presenting with neck symptoms, because neck joints can refer symptoms anywhere into the head, face, shoulder blade area, and down to the fingertips. And it can be isolated, meaning the patient could present just with elbow symptoms without any neck problems. But repeated movement testing is the main orthopedic test I use to figure out the diagnosis, and I find that most people have a mechanical problem. The joint's not moving well, and we can use one or two movements to get it back on track. But when it comes to repeated movement testing of the neck, I don't use lateral motions very often. The reason being, so many patients' neck disorders respond to movements in the sagittal plane. So when we start with testing in the sagittal plane, it often finishes there because we found a motion, either retraction, retraction extension, protrusion, flexion, that resolves the patient's signs and symptoms when performed repeatedly. But nonetheless, if we do go into lateral flexion of the neck, there are a couple things to keep in mind. For most patients, I want them to adopt some slight retraction before they go into the side bending. We can vary that, of course, to the individual, but that's what we do for the norm. Secondly, because we need some overpressure to get to end range, I'm usually getting there quite quickly in my testing. And the standard way to apply overpressure is by using the patient's own power with their hand. I usually want to use the hand on the side that we're going to in order to provide kind of a pulling motion. So it's retraction, side bend, and more of a pulling. But if this arm is too irritated from nerve tension or referred symptoms, we can use the other hand. So it's here, here, and then kind of a pushing. Also, if the muscles are being put on too much of a stretch and it's too painful, I can tell the patient they can shrug their shoulder a little bit to release some of that tension. But of course, I don't want them to then bend more, because we want the fulcrum to be in the neck and not the thoracic spine. So this, like any other repeated movement test, we do a certain number of reps and we retest the patient's signs and symptoms. Of course, symptoms are what the patients feel, and then signs would be something like range of motion of the neck or shoulder, or strength in the upper extremity, or nerve tension, or functional baseline. So sometimes I do use repeated movement testing of the neck that's outside the sagittal plane, so in the frontal or transverse planes. And when it comes to side bending, I typically have them go into some retraction first. Secondly, I typically get to overpressure quite quickly because we need that to get to full end range in the neck, using either the hand on the side that we're going toward, or on the opposite side. And thirdly, if we do this in sitting and the pressure or the tension on the muscles is too much to tolerate, they can shrug their shoulder to relieve some of this. Repeated movement testing, there are many different tests we use, but cervical side bending and sitting is one of them.